My name is Shattuck. I am the medical director at the Center for Sleep Disorders at St. Mary's Hospital in Auburn, Maine. We have a comprehensive sleep program. So my background is in psychiatry, but I see patients with all different types of sleep disorders. We have a couple nurse practitioners in our program. We have a 4-bed lab, and we do a lot of home sleep studies as well. I think probably the overarching issue is there's a lot of people who potentially have sleep apnea who are undiagnosed. And so increasing public awareness, increasing awareness in other providers of the importance of looking at sleep and asking those questions and trying to get these patients assessed and diagnosed. So there's so many patients who have undiagnosed sleep apnea. We'd estimate probably 80% of women, 90% of men are undiagnosed and have some level of sleep apnea. I think we've been using the WatchPAT exclusively. One of the advantages is you have a signal that gives you a sense of what's going on in the patient's cardiac function. So we can see that, and I can look at that in real time. The signal is very accurate. It's not susceptible to some of the artifacts you have when you're trying to go ahead and monitor respiratory effort. Another advantage is that it's very easy to apply. So there's 3 points of contact. You have the probe on the finger, you have the watch that's doing actigraphy, and then you have the position sensor as well, the snore microphone. So patients see that, and I think it dispels a lot of their concerns about sleep testing. It's also got a very low failure rate, so we don't have to repeat a lot of studies. We have WatchPAT ONEs, which are disposable. So particularly during the pandemic, we could take these devices and we can mail them out. People throw them out when they're done, so there's no concern about infection. You don't have to worry about disinfecting them. There's no concern about turnaround time because of that. The other thing is that the WatchPAT ONE, you can upload it in the morning, and so we can get the results really quickly. So conceivably, they're uploaded in the morning to the cloud, and then I could have the results the day after the test is dispensed. So it really can expedite the entire course of care. I think that's been a challenge in sleep medicine, is that getting the results and getting people into the sleep lab, which is traditionally where we've done all the testing, has been it's been a logjam. So now that we're able to do this with home sleep testing, it just expedites the whole flow of care, and people can get diagnosed and on treatment much more quickly. Reviewing the raw data is important so that I can actually see what's happening over the course of the entire night with the patient's breathing and their cardiac function by looking at the WatchPAT signal and seeing the fluctuations in the peripheral arterial tone. It allows me, from looking at the signal and reviewing it and analyzing it, to discriminate, are they having periodic breathing, or they're having chains of central events, or are they having mostly an obstructive pattern, which I can kind of line up looking at the signal and changes in the signal amplitude. It does allow us to go ahead, if somebody's on therapy, to do a study to test the efficacy of therapy. They don't necessarily have to come back into the lab. With the WatchPAT, I'm getting a sense of sleep stages. I also get position data, so that I'm also really able to see, are they having more events when they're supine? Are they having more events in REM sleep? So I'm able to drill into things and make a more specific diagnosis. And my experience with traditional flow-based devices has been that we often, because there's so many channels and wires hanging off of them, that we often lose a channel, and then you're trying to infer what's happening from some limited data. So I do feel more comfortable. This signal is very reliable, and it's usually pretty clear for the duration of the night. And so I can tell what's happening and really make what I feel is to be a pretty accurate diagnosis typically.